Royalty Beauty Brands is a female, Black-owned beauty company with all of your cosmetic needs in mind. Right now, we offer hair extensions, eyelash extensions, and our flagship product, Yumbella Lip Glam. Coming soon to add to our product line will be promo merchandise, lip oil, lip scrub, beard oil, body butter, body soap, and makeup, to name a few. Every product is vegan friendly and carefully made with the consumer in mind. Check out our Royalty Beauty Brand social media and go to our website to sign up for our exclusive mailing list for discount codes and to place an order. Don't forget to leave us some feedback. Royalty Beauty Brands. We see the beauty in you. Hi, everybody. Welcome to the House of the Princess, where I'm 50% righteous, 50% ratchet. Guess what? I'm 100% me. As you're coming in, welcome, welcome, welcome. First, I want you to stop on your way in and press that like button, even on the replay. Stop and press that good old like button. Also, I want you to subscribe to me because, see, I got some good stuff. I got some funny stuff. I got some stuff that's importante, muy importante, like today. And also, I just got some love for you. And I want you to show some love for me and press the subscribe button. And if you'd like to know every time I'm going live, just press the notification bell so that it can try to tell you every time I'm going live. But we know how YouTube be acting, but it's okay. Now, we're going to be mostly righteous today, but we're going to be a little bit of ratchet, okay? So, muy importante. Yes. Thank you, mother of dynasty. I love that word, the mother. That's what I'm going to have my grandkids call me when I get some mother dear. Okay, so thank y'all for coming in. Special shout out to my mods, the AKA the Knights in Shining Armor. Tell your friends and things to come on in here. We're going to talk about some good coochie talk, some little body talk. It's important. Don't shy away from it. We're going to talk about some good things today. So, guess what? While y'all getting all that together, I have a special guest today. I know some of y'all have been looking for this special guest, and maybe I'll be asking about like Hood and Pete. You know what I'm saying? But I got her here, and I am very excited. And also, I'm wearing my white and my pearls. It represents something. So I'm going to tell y'all in a minute after I get her up. So without further ado, I am going to add the wonderful, illustrious Dr. Ivie. Hey!
Hi, princess.
Y'all get the claps in the chats and the crowns in the chat. How are you doing today?
I'm doing amazing. Congratulations, princess, for all of your success. And I'm so excited to be here.
Thank you. We are happy to have you. They really do be asking about you. I'm like, she goes live on Saturdays sometimes.
Yeah.
But we know you're a hardworking woman.
I'm trying to keep up with you.
Look, I'm half and half with that Lady Alicia. They trying to take me out of the position.
Oh my gosh.
Look at here. You look at all the love here.
Oh, hi. Oh, I love Nikita. Oh, I miss everyone. Yeah. Hey guys.
So y'all make sure y'all follow Dr. Ivie. Y'all gonna find her YouTube page before the end of the day today, okay? Let's see, welcome, mother. Welcome, Dr. Ivie. So we're gonna talk some good talk about health. Women's health specifically. I know the larger part of my audience is women 35 to 55. That's what my analytics say. But even if you're a man, there are some things that you need to know as well, because you try to get coochie from women. You need to be understanding of what our plight is. You may have a daughter. You have a mother, apparently. So this is something for everybody. Yes, I will have the link in the description box, and I'll be putting it up during the live. Yes, I'm gonna have one ghetto moment in about 30 minutes. I don't know, but we'll try to curtail that. Also, well, first, before I go into that, to the celebration of the day, Dr. Ivie, can you formally introduce yourself to those who may not know who you are?
Okay, sure. So again, thank you for having me on this platform. My name is Dr. Ivie Okundaye Appiah, and I am an internal medicine doctor. So I deal with adults. And I also board certified and also I'm a nephrologist. So I went on to do additional training in kidney disease. So yeah, that's a little bit about me. In addition, I'm a Midwesterner. I'm a Midwest girl, but I've bounced all over the country and recently finished my fellowship training in nephrology at Stanford in California. And so now I'm running my own business and, hoping to really encourage people, particularly people of our community, to just be their own health advocates. So, as Princess mentioned, I do also have a social media platform and a YouTube channel. So it's my name, EVA, spelled Ivie Okundaye Appiah. So if you just type in EVA Appiah, you'll find me on YouTube. And we talk all things health and wellness. And recently I did a health series trying to encourage pretty much everyone, but basically coming up with a health plan for people of different stages of life. We did the ultimate health plan for the bride, for the divorcee, and the professional woman. So there's a lot more tuned in for my platform, and I just would love for you guys to, come and follow me. But I'm amazing. I feel happy to be here. Thank you so much, Princess.
You're a star. Okay. Before we get deep into the conversation, we have a few things to see people talk to me while I'm online. It lets me know that they're not watching me. Okay. Somebody said you're very intelligent. Yes, she is.
Beautiful.
What's the day is? I'm wearing white. Ebit is in the house. Hey, Ebit. I'm wearing white today. I'm wearing pearls in representation of life. We are also in my celebration of life. And what that means is last year, July 13, 2020, during the whole pandemic. Okay, I'm gonna need you to stop, girl. During the pandemic, I officially stopped going to work July 13th. I came in and said, well, I gotta go get my blood work. I knew I was doing what I was doing, but that was like my last date where everybody said goodbye to me. I went in and I got my blood work in order to have surgery. Okay. In order to have surgery. Thank you. I had a hysterectomy July 15th, 2020. So I went into the hospital a day early on July 14th. And I was kind of bad. I was the walking dead, as I like to say. So it was very traumatic as a process for me with that. And I know somebody, and here this internet is messing up. I know there is someone out there who may be suffering like I did. Even with your regular health, I think it's important to go see about yourself. And even if you see about yourself, you may not get the right answers, but to push your doctors to give you the right answers. So, hey, Candy, I want y'all to celebrate with me that I'm living and I made it out of surgery, because I didn't know if I was going to go to the other side. So it took a toll on me. But before I go into detail with that, I'm going to show you a quick video that I made. Look, here we go. Somebody said I am suffering right now. I'm going to show you a quick video. It was a piece of a documentary that I hope to one day make a bigger documentary. This year I've kind of fallen off with the goal, but I'm not going to give up the goal. But I want other people to be involved with it as well. So I'm going to show you the little video of the background so that some of y'all can kind of know where I'm coming from. Partial hysterectomy, April 6, 2018. All right, somebody told me yesterday, I think they said we're Hister sisters. So Hister sisters, white represents now that you can wear white, because all those days you be worried about your period and all that, and you can't wear white because you mess up your clothes. When you have hysterectomy, white is the color to celebrate. So I'm going to show this video real quick. Oh, let's make it all the way. Boom. On July 15, 2020, I was ready to die. But who can really prepare for that? I prayed that my soul will rest with God, but we all know that's not that simple. Who will look after my kids? What about my hopes and dreams that I've never accomplished? Will anybody miss me? Because 60% of people don't even pronounce my name correctly. So why would they give a damn? Let's rewind a little bit. This girl here, that's me, Avella. And when you see her, you see this beautiful, happy, confident socialite. But what you don't see is what many women go through: the physical pain, depression, loneliness, discouragement. From about 2015 to 2018, I was suffering from uterine fibroids, undiagnosed. I was diagnosed with minor anemia around 2005, but I did not exhibit any severe symptoms of this plague until about 2017. This is my journey. First of all, let me give you the facts and background. Fibroids are muscular tumors that grow in the wall of the uterus. Fibroids are almost always non-cancerous, and not all women with fibroids have symptoms. Treatment for uterine fibroids depends on your symptoms. Black women tend to experience fibroids at a younger age and often more severely than their white counterparts. One estimate is that 25% of African American women will suffer from fibroids by the age of 25, and 80% of them by the age of 50, compared to 70% of white females. Now, because Black women suffer from fibroids at an early age, they are 2 to 3 times more likely to undergo surgery. Now, prior to my final treatment, I suffered from severe low iron. The average woman my age would have the hemoglobin levels of 12 to 15 grams per deciliter. Mine will plummet as low as 5. I was the walking dead. And over time, I endured 3 blood transfusions. I was tired all the time, but I was forced to operate as normal. I didn't look sick, so people were insensitive when I fell short. I was lazy, or I was exhibiting trifling behavior. Now, after 2 years of non-effective treatment, including changing birth control 5 times, I decided to have a hysterectomy. I was tired of uncontrollably bleeding, having to wear damn near diapers for sanitary napkins, and I really just wanted the suffering to stop. And it was the scariest thing I've ever experienced in my life. What made it worse is that it was a pandemic. And on July 3rd, I had a blood transfusion while everybody was with their families, but I was alone. I had to repeatedly take COVID tests, and ultimately, I was admitted to the hospital a day early on July 14th because my pre-op blood work said that my blood was so low that I couldn't carry the surgery. I needed a 4th blood transfusion. My doctor ultimately asked me, how was I even walking every day? The surgery morning was a mess to me. I have a father-daughter team of gynecologists whom I trust, but it still wasn't comforting. I was bruising from all of the IVs, and they needed to give me an epidural and more blood. My spirit was tired. My body was in excruciating pain, and I cried like a baby in the OR, and I cursed too. 5.5 hours later, I woke up. I had made it. I was alive, but I could no longer have children. Due to COVID, I have no one there that could hold my hand. I was hospitalized for 5 days, whereas I had to learn to walk again, sit up, and use the restroom before I could go home. But I now entertained the nursing staff because I brought my own pajamas to change into every day. They called me Diva, and they said I was the best looking to have surgery. The whole time I was in school as well. And I hid my situation from my classmates. And I even logged into class the day after surgery, drugged up and all. I didn't want to fall behind. The struggle was real at home. My teenage daughter was the only person that could take care of me. And I had to walk on a walker, sit and shower. I needed assistance turning over in the bed and my meals made for me. 1 month into recovery, lightning struck the tree in front of my house and fell into the roof of my apartment. I had to stay throughout the rehabilitation. And in the beginning of October, I had an allergic reaction that left me hospitalized again for 5.5 days. My entire body broke out in hives, which left me miserable. And after testing, I found out that I'm allergic to Alternaria alternata, but it's inconclusive as to why I was sick. And today I'm steady recovering, but I still feel the effects. My stomach doesn't have 100% feeling in it, and I've experienced muscle atrophy, but I'm in fighting. I work hard towards healing every day, and this project is a part of my graduation piece. My name is Avella, and I've lived through fibroids, and you can too. That's my story.
You know, Princess, it's a beautiful testimony. And, you know, thank you for sharing. You've gone through a lot of heartache, but I mean, look at you now. Look at
Yes.
you now. And thank you for just opening up your platform. Oh, look at you right now. Right now.
And God is good. I'm sure there's somebody who's gone through even worse. Thank you for y'all support in the chat. Don't cry, because I ain't crying. I might have cried then. Get your cool beverage, okay? Because I have life and I'm here. And I'm able to chase my dreams and talk to you on today. And I'm all right. You have fibroids and cancer in 2011. Wow, that's a lot. So we are going to talk about these things. And if you want to call in tonight, we're going to take a few calls. Thank you. Thank you for your support. Oh, yeah, Dr. Ivie, thank you for the super chat. Do you see how God you're on your test into a testimony to encourage other women? Yes. You know, and as many times as I was growing up or I be going through things and I'm like, oh my God, why me? And God said, it's not always for you. It's for other people. You know, you're doing something with your life. So you go through it so that you can help someone else either go through their pain or not go through the same situation. So if we can tonight, we're going to talk to some people and have conversations that need to be had in order for you to see about yourself. I feel that it is often that women do not go to the gynecologist, that do not go to their primary care physician, either because, oh, wow, I'm sorry to hear that. Either because they're scared or they don't have the insurance or they don't think it's important. So what are your thoughts on that, Dr. Ivie?
I mean, everything that you said in your video is so spot on. And there was a lot of really accurate information. I'll just say this. Unfortunately, for almost every disease out there, Black people tend to do worse. And I know you have a lot of people on your platform So it's not just Black people, but I just wanted to, share that because in general in this country,
the light-skinned people are our cousins. They understand.
Right. But I know it's really for everybody, but across the board in this country, leading cause of death, unfortunately, is heart disease. So meaning heart attack and stroke. And unfortunately, Black people, we unfortunately do worse for almost every single thing. And a lot of the things you talked about are so true. Growing up, I used to live in like Southside Chicago. A lot of people were really scared to go to the doctor because they didn't want to get bad news. And, the issue with that is if you wait, sometimes things pop up and it gets so bad to the point where you may need something serious, or unfortunately, it can get really serious rather than finding out something early and then being able to intervene and change the outcome, for example. So yeah, I just think overall, if we can get, more people in to see doctors and trying not to be afraid. But then the other thing is also finding a doctor that you feel comfortable with and finding people who can talk to you in the right way. I always say, anytime I move, I need to find like a new hairstylist, a new grocery store, a new whatever, right? Same thing, when you move as well, you need to find a doctor that works for you. A lot of doctors, most doctors really are competent and they really are well-intentioned. However, if something doesn't quite work for whatever reason, find a doctor that you feel you can work with and talk to. And for me, I try and honestly give guidance. I don't just answer the questions that were asked and just that's it. No. For me, I try and ask, my patients, okay, nice to meet you. What are your health goals? And then we can together form a plan together. So some doctors have different approaches, but finding a doctor that works with your goals and your, like what works for you, like your communication style, your schedule, there's a right approach.
Dory says, why is that, Dr. Ivie? I think that's in reference to why people wasn't going to the doctor or scared to go to the doctor.
Oh my gosh, there's so many reasons. Honestly, sometimes we're just so busy and life happens. A lot of times we put other people before us. And I remember you kind of talked about your own experience. You knew something was off, but didn't necessarily, right away go to the doctor. Maybe you were busy and there were a lot of other things going on and competing, priorities. So I think it's just people are busy. Sometimes I think it's financial. Sometimes, if you didn't really grow up going to the doctor, then it doesn't even occur to you like, oh, there's nothing wrong with me. Like I feel fine. No, even if you feel good, still just get your annual visit at least once a year. Just, get your blood work, talk to your doctor, get your physical, and then move on, and you just see them next year. But yeah, I think it's a lot of things. Sometimes people don't find a doctor that they feel all the way comfortable with, or maybe where you live, money reasons. Yeah. But I just want to encourage people to go ahead and not be afraid. Find your doctor, even if you have to drive 30 minutes. You are worth it. You are absolutely worth it. If you spend time for other people or for that 9-to-5 job that you don't really like, you are worth it. Absolutely.
Mother Diamond says, family and friends told me I was depressed. I also have 4 blood transfusions and 3 iron infusions. Look, I would be depressed. I think I was depressed once you have those blood transfusions and you're only well for a certain amount of time. And I think kind of with me also is I went to the doctor, but they kept saying, oh, it's probably this. Oh, let's change this. Oh, let's change that. And they never dig deep. I forgot it was just one trigger thing that one of my doctors, my main doctors, his son, they have a practice. So I started seeing his son and I got real sick and I was throwing up. And sometimes they were like, oh, it's food poisoning. Oh, you eating the wrong things. different. And one day he was just like, let's do an ultrasound and let's do some blood work. And I knew when I got that call back from him,
direct.
Yeah, I was like, oh my God. And that is when we really started to break down. It took 2 years. We started to break down what was happening. So then I was going between my primary care doctor to my gastroenterologist, I don't know if I'm saying that right, and my gynecologist. So it was a collaborative effort between all of them to really start to find out what was going on with me.
Absolutely. And I commend you for just working with the system. So, not everyone is
tiring. It is frustrating.
And not only is it tiring, like on your spirit, but you were also, you talked about the fact that you were anemic, meaning your blood count was so low. People, when their blood count is low, do you know what the red blood cells, this is what carries oxygen in your body. So you can breathe, think, and your body is working. If your blood count is low, that means your body is just not going to function well. And if it's really dangerously low, you have to get that transfusion. You have to get that transfusion. So I'm so sorry. And people they can feel so fatigued. But if your blood count is low over time, sometimes that becomes the new normal. And you're like, why am I so tired? Like, you don't even know that you're having breathing problems because that becomes like normalized. And so sometimes patients are like, oh my gosh, now that I think about it, I haven't been feeling well for 6 months, a year. And then,
and I'm an asthmatic, and then I was a little bit overweight. So I'm thinking like, oh, I just need to exercise more, or maybe it's the air. So when asthma kicks in, I'm not thinking, I don't know anything about, I don't have red blood cells to help me breathe, to help me do anything.
Right. And of course you wouldn't know, but I'm just trying to encourage other people in general, definitely, see your doctor so they can help guide you.
And get blood work. I think we don't get blood work done on us often enough to even be able to see those triggers to make sure that all our levels are on the right. On the right. Now she says, I remember having only 3 pints of blood. The only reason why I found out is because I developed in, I guess, itch. It would not go away. And I went to the doctor and it was low blood.
Okay. Yeah.
Now, are you familiar with this term? She says, I'm going through thyroidism and cyst, but I'm praying every day for God to bless me with healthy twin babies.
Yeah. Thyroid, there's different types of thyroid disease. It's one of the organs that's in the neck, and it basically helps regulate an important hormone. But for people who they can have either an overactive thyroid or sometimes an underactive thyroid. So yeah, depending on what kind of flavor she has, there can be a lot of things. Then cysts, you can get cysts anywhere on the body. So it really just depends. Sometimes you can even develop, growths on the thyroid itself, and that needs to be checked out. But yeah, you know what? Again, I commend you, Princess. I really commend you for just sharing your story.
Thank you. Thank you for the super chat. High vibe. Thank God for life. I had a hysterectomy in 2017. I had 4 transfusions. Fibroids are no joke. Can Dr. Ivie speak on the cortisol levels impact and our reproductive health? Is there a connection with fibroids as in preterm births?
Yeah, so very good question. So what I will say is this, in general, Black women, we tend to have actually worse maternal mortality, meaning we're more likely to die, unfortunately, during pregnancy or any like pregnancy related death. And there's a lot of reasons for that. And there's some thought that fibroids, which is more common in African-American populations, that's maybe the cause, because sometimes these fibroids, these are growths within the uterus, they can grow and actually impair fertility. If you have, golf ball size growth in your uterus, then that impacts the ability for a baby, obviously, to grow. So yeah, it's definitely linked to our reproductive health in general, but particularly for African American women. And then I'm not aware of how cortisol can impact specifically like our reproductive health. However, stress in general, stress can raise your cortisol levels, and stress can actually impair your fertility as well. Because if your mind is focused on surviving or dealing with the stress, then there's some thought that your body is less likely to take a pregnancy. And the body has sophisticated mechanisms as to why it can do that. If you need to eat, you probably don't want to have a child. That's how the body kind of handles that, or an extreme stress, such as not eating or dealing with danger and things like that. But yeah, it depends on the person and the body and their other medical conditions. And again, that's why I encourage all of us to see the doctor. And when you talk about reproductive health issues, this is something that's, really near and dear to my heart, but I can talk about that, later. But yeah, very good question.
Well, we got a few minutes to talk about it. Thank you. We're glad. And I'm going to step away for a hot second. Shay says she had 4 infusions, iron infusions. And today she went to the doctor and seen that her iron was not low enough for that. But what are some ways that we can help, like, not have those issues? Of, or help with our iron, keeping our iron up, other than just taking iron pills?
Okay, that's a really good question. So anemia or low blood count is common. In fact, I even personally had a relatively low blood count, but not requiring transfusions, like personally myself. And there's a lot of reasons for that. And it depends on your age, but one serious one we have to consider is bleeding through the gastrointestinal tract, your feeding tract. And that's why it's important for adults to get colonoscopies. And the standard age is about 50, and sometimes bleeding can come from the gastrointestinal tract because of cancer. So the biggest concern is colon cancer, and that's why there's a recommendation for colon cancer screening with a colonoscopy. So that's something that's really important. If you come into my office and say, that you want to deal with your anemia, that's one of the first things I have to figure out is, could this patient be bleeding from his or her GI or gastrointestinal tract, potentially from something as serious as a colon cancer? So depending on the situation, you may be appropriate for colon cancer screening in general. The other common cause, and a lot of your viewers are women, is actually from the menstrual period. And, for me, this is something I see commonly. Women, sometimes we just have heavy periods. We just have heavy periods. And sometimes you can bleed so much that your blood count gets low. So how do you deal with heavy periods? Talk to your doctor, but there are a lot of ways that we can deal with that. Sometimes we put people on birth control just to help regulate their hormones and make it more gentle on the body. There are other medications that can just slow the rate of blood loss. And then also, of course, iron pills. Iron helps the body to make red blood cells, because that's a key part. It's basically helps to anchor the red blood cell and, provide the oxygen for the body. So those are some of the 3 major things that I think about. But yeah, just, talking to your doctor about it. Absolutely.
Yeah. And Grace says they called her at work and scheduled for emergency blood transfusion. That is exactly the same way that I learned that my first blood transfusion was happening. I'm like, he called me like at work immediately himself. And that was like the scariest thing to have that happen. Now, can we address the mental part? Why? Well, I don't know if it's a full answer that Black women's pain is documented to be minimalized because our pain thresholds are so high. And we're discounted in hospitals and with our doctors.
Actually, that's a huge concern for me. And I have a problem with that. And you remember Serena Williams talked about her own experience that this is public knowledge. I don't know her. I've never treated her or anything like that. But just what she talked about, I was like I was just disheartened. But yeah, there is bias. Okay, there's racial bias in the world everywhere we go, and I've talked about this on my platform too. I think we have a more sophisticated understanding of race and how to approach these issues, and healthcare is no different. So yeah, there's a lot of biases, and there is some thought about Black people having higher pain thresholds. But if you're in pain, we have to speak up. Sometimes we don't necessarily feel empowered, or we get shy, or we're scared. No. And that goes back to finding a doctor that you like, that understands you. And, if they know you for a longer period of time, then your doctor or your healthcare team can advocate for you because they have documented understanding of what's going on with your body, lab tests, exams, physical. Do you know what I mean? So yeah, we really just need to be plugged into the system. And by the way, that's why I also advocate for more Black people to go into medicine, because if we have people that look like us and represent us, of course, most doctors, they know what they're doing. All doctors know what they're doing. But I'm saying that sometimes that connection makes all the difference in the world. Yeah.
This is interesting. An ectopic pregnancy in her tube had bust, and she was bleeding internally and was immediately taken in for a day surgery to remove the tube in pregnancy. But she was miscarrying on Friday and didn't even go into the hospital until Monday.
See, that ectopic pregnancy can kill people. It's serious, extremely serious. I'm so sorry, Miss Evelyn. No, that's serious. I'm glad you got the surgery and it's, behind you, but very serious. Very serious,
yeah. We were talking earlier and you were mentioning, like, you're especially about, I want you to talk to them before we take some calls about your pregnancy and working women, or I don't know how to explain it correctly. So
right. No, it's kind of like cutting edge. So my field is women's kidney health or obstetric nephrology. So I mentioned before that I deal with adults and also did additional training and specialty in kidney disease. And so my goal with my research is to try and improve outcomes in fertility and pregnancy for women who have chronic kidney disease. And my research at Stanford, I'm working with the team of epidemiologists and biostatisticians to look at how can we improve outcomes on these issues, So I've submitted some research work to journals to see, how good are we at documenting our conversations about reproductive health in the kidney clinic. I'm also looking at Medicare claims data to see what contraception is being used in the chronic kidney disease population. So for those of you who want more detail, but overall, women's health, how can we do better counseling about these issues in advance? And the reason it's important is because if a woman who has kidney disease gets pregnant, oftentimes the kidney disease can get worse to the point where the kidney fails and that patient might need dialysis. That's number one. The second reason is because a pregnancy actually could have complications if you also have kidney disease compared to not having kidney disease, where people can have preterm delivery, a term called intrauterine growth restriction, and it can be so serious as neonatal death. So it's important upfront to counsel people about pregnancy, how to prepare the woman and the patient and the family for a healthy pregnancy. So I have a lot of research surrounding that.
Thank you, Marcella, for the super chat.
Hello.
Okay, and I saw something, and this goes back to what you said. I'm trying to find the comment, which, oh, this is it, which is something when I was suffering with my fibroids, I never thought about. Not only is she saying that your red blood cells give you oxygen, but you need oxygen to breathe. You need oxygen to keep your heart going. And I had no idea that I could have possibly, because I'm walking around my blood level so low, have a heart attack in my 30s.
And if it's sustained, if it's sustained, you're just putting more and more stress on the body. You don't need that. For anybody, even if you're healthy and your blood count gets low, the body is going to feel it. You're going to feel it. So that's my whole point, is just to try and get in early. Sometimes I feel like the best medicine is like prevention. For some people think, I just want to push pills, or doctors just want to push pills and they don't care about prevention. That is not true. And again, healthcare is evolving. And I know for me and in my practice, I like to be really aggressive in the beginning, get to know you, and try and figure out, okay, what are your goals so we can prevent? It's easier to try and prevent things or treat them early on than deal with the consequences, much later. So you're
And
right.
with that being said, we're gonna put all that up later. Again, I'm gonna put it in the description box with this video as well for the replay. With that being said, like I said, I went for years undiagnosed, and I did put that as one of the questions. Is there any way, or what could be prevention of making sure we're up to speed if we have fibroids, or we have anything going on with our uterus, or anything going on with ourselves to help before it gets this bad that we need a hysterectomy or laparotomy or myomectomy or anything, or our blood is getting too low? Is there any preventative things that we can start to do?
Yeah, no, that's a very good question. Honestly, you can't help fibroids. The body, unfortunately, fibroids are an abnormal growth within the uterus. And so you can't control that. What I'm trying to say is that going to the doctor and getting routine tests will help catch them early on so that they can make the appropriate treatments. So in general, what I'm talking about is seeing your primary care doctor. I also recommend having also a separate gynecologist. Sometimes the primary care doctors can do you guys may have heard of the term like pap smears, your gynecologic exam, where you put your legs up in the stirrups and, spread it.
Don't we love that?
So I did that with internal medicine only. So I've done that and I feel completely comfortable. But some people may want to see a gynecologist. I like just seeing a gynecologist because that's their expertise as well. And they deal with, obviously, women's health. So I would just say those things. The second thing I would talk about is, you talked about kind of depression. We have to put ourselves first. And a lot of times, a lot of your audience is women, we put other people first and don't even realize it. Okay. And then at the end of the day, we ourselves are just crashing and burning. Sometimes we serve as caregivers for other people. They're not just health, but just, your spouse who's trying to go to law school, or, a neighbor who is in need, or, a family member who may be incarcerated or something. Like, you're always doing something. So just putting yourself as a priority so you go see the doctor. The other thing I wanted to say, it was so important I wanted to mention. Oh, it's going to come back to me. Sorry, I kind of forgot the last.
You have a brain fart. It'll come back.
I had a brain fart because my mind goes everywhere. But anyway, just definitely seeing the doctor periodically is going to help identify a problem if it's there, and then point you in the right direction so you're acquainted with the healthcare system. You know what I mean? And they can help you. They can guide you. Yeah.
Here's a question. Can being anemic and having fibroids cause a blood clot to break and cause death?
You can have blood clots. I will say that you can have blood clots. Now, that's kind of a hard question to answer, because the question is, why did you have blood clots in the first place? Sometimes you can have blood clots that causes your blood count to get low, and sometimes you can have fibroids that are bleeding your blood clot and cause bleeding to the point where your blood count is low and requiring transfusions. So yeah, I mean, yeah, it's very possible. Then the other thing I wanted to mention is, the concern about blood clots in general is they can form in the body and then travel. So if it travels, it can cause a stroke. If it goes to, in the blood clot can break off and circulate in the body. And unfortunately, if it goes into the brain, it can cause a stroke and kill you. So that's a concern. The other thing is it can travel into the lungs and cause something they call a pulmonary embolism or lung clot. And that can also kill people. So yeah, it is possible. I can't, but the most important thing is seeing a gynecologist. I would absolutely recommend that.
Somebody just commented about a pulmonary embolism. So okay. Chris J says, I had a myomectomy back in April to remove 12 pounds of fibroids. Was anemic prior, and it's hard to get my blood count back to normal. Iron pills have just kept me slightly above the critical level. You lost a lot.
That's a lot.
You lost a lot.
I'm sorry to hear that.
I'm going to, now look, we're not going to keep Dr. Ivie all night, but I'm going to open up the chat for some calls, okay? So we're going to keep it to a couple of minutes or less on y'all's behalf. So I'm about to drop that in there. But I'm on a few more questions before I let y'all in. Lala Chanel says, why do so many African-American women seem to experience issues with birth control?
Oh my gosh, I feel you. I absolutely feel you. In fact, that's one of my areas that I actually study. Okay, first of all, a lot of us are not even on birth control. Yes, you have a right to, if you want to be on birth control, you have a right to be on birth control, number one. Sometimes we just don't make that step to say, okay, this is what I want to do and actually implement it. So that means talking to your doctor and saying, hey, I want birth control. The second thing is there's a lot of variety of safe and effective birth controls for people. Obviously, the most common is the pill, and then there are other things like implants in the arm, injections periodically, and then, of course, the IUD or intrauterine device. It's a device that's inserted into the uterus through the vagina, and it's a procedure. So there's a lot, and that's the most effective one. So
hated it.
But unfortunately, it's a procedure. So with the procedure, sometimes there can be complications from a procedure. And I've actually helped assist place the intrauterine devices in med school as well. So I mean, I'm very familiar with them. And even in my clinic, in fact, like in residency, I had a small clinic within a clinic where I was just focusing on contraception, because you're right, there's a lot of misinformation, and it's really honestly easy and effective for the most part. So why do Black women, I think sometimes we just don't have the same access and don't necessarily feel empowered, but you can do it. You really can do it. And like I said, I'm also available for questions, not necessarily as medical advice, but just information, and can try and point you in the right direction. But yeah.
Dr. Ivie, are there benefits to taking the HPV vaccine?
For the most part, yes, absolutely. And basically, HPV helps reduce your risk of cervical cancer. And basically, anyone who has sexual encounters is at risk for getting HPV, which increases your risk. There are a couple of strains that are high risk for cervical cancer. And again, for Black women, we have, unfortunately, we have issues with these gynecologic cancer screenings, like uterine cancer, ovarian cancer, but cervical cancer is a big one. And so, it's supposed to reduce your risk for getting a cervical cancer. And so I recommend it. I personally got it, and I do recommend it for most people. But talk to your doctor, depending on the age as well, depending on the age and your situation.
Is this true, Dr. Ivie? You was on the video show in the front row.
Egypt, you are good. It is true. Egypt, are you kidding me?
Let me find out.
How did you spot me? I'm in shock. Okay, so I just celebrated a birthday. My birthday is June 24, and to celebrate, I went on.
You were like the first one to go back to Wendy.
Yeah, and honestly, she is a star. That's what I will say.
See, now I'm gonna go back and look.
Yeah. I'll send you the link. I'll send you some pictures. But yeah, I almost told like nobody. Actually, nobody really knows that. I didn't post it on social media. That's so funny. But yeah, I did that to celebrate my birthday. Yeah.
You and the young man share the same birthday.
Oh yeah. Yeah.
You got all these, you had a good birthday. You was in New York, the city never sleeps. So you had a good old time.
I did.
And it was open, okay? We're going to take a couple of calls. Let's get it popping. If you want to call in, the address or the call-in link is pinned in the chat and the blue part. In the meantime, like, subscribe, because again, I have a whole lot of different type of comment. I'm just not one-dimensional, because we all are multi-dimensional people. So we need to talk about everything. So
Princess, I remembered what my brain fart was about. The other thing I wanted to mention, you asked a question like, okay, what can we do to prevent and encourage reproductive health in general? The other thing I wanted to say is we should share our story. And that's why your platform is so important, because know your own personal history, meaning, see the doctor, understand what's going on with your body. And if you need to write notes, take notes, know that. If you need to ask questions of your doctor to have a better understanding, know that. And then the other thing is talk to the other women in your family, because sometimes we don't always talk to each other and not even realizing like, oh, I have a mom and an aunt and a cousin who all have the same issue. And if you're not even aware, you wouldn't even think to say, hey, there's a family history of fibroids in my family, or something, or lupus, for example. That's something that's also common. You just never know.
My mom had fibroids. I didn't know. She went, I guess, for a myomectomy or whatever. She went on an outpatient procedure, and I went to the hospital where she walked back out. I didn't even know she had those problems. And I didn't have problems most of my life until I got older, till like 35. It's crazy.
And for example, breast cancer, the reason it's important to know in your family is because sometimes these things are genetic. There are genetic causes for cancers or other conditions, number one. And two, it helps us as providers and doctors to screen earlier. And then also it helps us to plan if you want to have a family of your own. So you can understand, hey, if I have a child, here's the potential risk of having a child. Another thing I recommend in general, it's not really related to, it kind of is related to reproductive health. I feel like every single African American should know their sickle cell status, because 1 in 12 of people of African descent will carry the sickle cell trait.
Right.
Okay. And so if you have two traits come together, you can have the full-blown disease. And that is its own big thing. And,
who you're reproducing with.
Yeah. Yes. And so that's, so yeah, those are things I encourage on my channel. Like, women, we need to be empowered. Okay. Do I have a contraception plan? Do I want to have children down the road? Do I want to be married with children? Yes or no? Because women are doing things in different ways now, and there are different ways to have families with modern medicine. And then you know, if you're having a sexual relationship, being confident and you know, asking your partner, did you get a check for STDs? Bring your paperwork. Bring your, you know, I talk about this on my channel, bring your receipts. Everyone needs to bring their receipts to the table. So meaning, like, if someone wants to have a sexual relationship or has already started, you need to be like, excuse me, you know, here's when I got my STD check. I got all these diseases checked, including HIV, and I was negative at such and such date. Can I see yours? And if it's positive,
and if they turn you down, then you don't need to sleep with them anyway.
No, it's okay. We're all adults. So I'm just trying to encourage people to use health information to make their lives better and more like work for you. You don't need to react and be like a victim to health. You can use it to empower yourself and make your life easier. So that's what I do. I want to help.
Okay. This question. Hello, Princess and Doctor. Can you tell me what's a good over-the-counter herb or vitamin for a woman going through menopause?
Oh, that's a good question. You know, Princess, if you have recommendations, you know, go ahead and shout them out. What I will say is, even before the menopause, big one is calcium. Sometimes we don't get calcium through our diet. So calcium and vitamin D are related. Calcium helps to make strong, healthy bones. And the concern for postmenopausal women is the bones get weak, in particular weak. And fortunately, if the bones get weak, you know, we can get fractures and that it can impact your quality of life. Yeah, absolutely. So just in general, making sure you get calcium and checking your vitamin D level. Talk to your doctor about that. Vitamin D can be activated through exposure to the sun, and sometimes we just are not in the sun as much for work or whatever. But yeah, just making sure you have a good amount of calcium in your diet, and also your general multivitamin generally will be very good. Yeah, good question. And
Thank you,
oh, go ahead. Sorry.
Thank you, Sister Surnitra, for the super chat.
Excellent
show, Princess and Doctor.
Beautiful.
Okay, go ahead, Dr. Ivie, what's your statement?
Oh, I was going to also say, again, also for women, even if you don't want to get pregnant, remember to take a prenatal vitamin because of the folic acid. Now, remember, a general multivitamin does not mean you have the appropriate, it's not a prenatal vitamin. A women's multivitamin is not necessarily a prenatal vitamin. A regular multivitamin is not the same as a prenatal vitamin. The key part about a prenatal vitamin is that it has the necessary folic acid, which means that it helps to prevent brain-related and spinal cord-related defects in a baby. So women, get your folic acid, and usually we recommend around 800 micrograms. So not all multivitamins have that amount of folic acid. So prenatal vitamin, check that. And sorry, last also comment is, when you're reading a multivitamin, have you ever bought a bottle of vitamins, right? You have to check on the back and see how many tablets you're supposed to swallow every day. Sometimes the serving is 1 and sometimes it's actually 2. People don't realize that. Read the back and say what their requirement is. Because you could be taking half. If it's supposed to be 2 pills and you're only taking 1 pill, you're not getting what you're supposed to be getting. So that's what I would say. Hey, Marcella.
Hey, Dr. Ivie and Princess, y'all look so beautiful. Did you say you were pregnant?
Who pregnant?
I have a vision, Dr. Ivie.
Oh, I said she was a pregnancy specialist. Okay.
Look,
I'm going to tell you, I have a carrier, so we'll talk about that too.
Listen, Marcella.
I had a partial hysterectomy. I had a partial hysterectomy, and then like a year later, I started having pain, and they had to give me a whole hysterectomy. But then I've been getting sharp pains in my side, and so I have had 6 like DNCs. and they had to keep removing scar tissue. I started drinking alkaline water, black seed oil, the vitamin, vitamin D, and calcium pills, and I get B12 injections. But every couple of years they have to go back in because I have such a sharp pain, and I'm not being nasty. Like when my husband entered me, it hurts so bad. So they gave me they gave me these pills called clonidine, and that's usually for sleep, right? But it helped me with my menopause pain, and they gave me estrogen, but I don't take the estrogen every day. Okay. I won't take it because it causes facial hair and stuff, but I try to supplement it with the vitamin, and I go to a black herbal store who gives me, the tablets with, he got yellow dock in it, white pine, red clover, poke root, and stuff where I don't have that pain, but when it starts coming, it is so hard. And when I go back to my gynecologist, he does surgery every time. He always give me a DNC, and he has to take a lot of scar tissue out. I mean, it hurts.
I'm so sorry.
Well, why repeatedly?
The scar tissue grows back, and on one time the scar tissue grew before I had my hysterectomy, and it was clinging around my ovaries, so they were pulling.
Yeah.
And so they just went in and took everything out, but sometimes I still get that sharp pain, and I don't know. I don't want to keep having surgeries. One time I had the DNC surgery, and it's an in and out process. And something happened where I ended up being admitted into the hospital because I had got blood that filled up on the side of my stomach.
Oh gosh, that's terrible.
But now that I got my hysterectomy, people say you don't want to have sex, but I do. I still have that desire, and a lot of women told me, you're not going to want to be touched or nothing. And that hasn't affected me. Having a hysterectomy, does it cause you not to want to have sex and not to?
I likes to have it when I could get some.
Well, that's a very good question, because your hormones are going to be just different, and depending on if you also took. Sometimes people also take not just the uterus but the ovaries. Ovaries are where basically the body produces the eggs, and eggs are what released during a period, to have a baby. So it depends on the situation, but yeah, a lot of people report that. And it's not just removing the uterus, it's also the psychology, like your emotional state, because a lot of us women, we feel more feminine in some ways when we have a uterus. And so if your body is different for whatever reason, for surgery or for whatever, sometimes our mind just doesn't enjoy sex as much, or we don't feel as pleasurable. Yeah. And then working with your partner, who knows, like after having a baby, this is something that's common after having a baby, because sometimes that area is still being healed. Literally, there are vaginal tears. Sometimes the anus has been torn. And so, yourself, how you see yourself sexually, it can be altered. And then working with your partner, it changes your perception and how you feel. So yeah, it's a big process. The other big one is breast cancer, and those who've had, not breast reductions, but like surgeries, lumpectomies, or surgical removal. If you've had to have your breast removed before, like after a cancer, or if you find something, sometimes that people feel like, oh my God, they just don't have that urge as well. So I think it's layered, but there are things women can do to try and spice up and try and get that back. And it's not just psychology. Sometimes it's just painful, like with insertion, and maybe you don't have the same lubrication and stuff like that. But hey, modern medicine, we have options. We don't have.
Oh well,
We don't.
But another thing, I had my breasts checked, and they came back and said they found they told me I was drinking too much coffee. It was too much like caffeine in my breast. And they told me that, you know, because they saw something and I was all going crazy. And when I went back in, they just told me I needed to lay off the caffeine.
I've seen that happen. And you know what other things that have happened I've seen, just because you have a spot on your breast doesn't mean the spot is cancer. I just want to say that.
Right.
First of all, good job for going to see the doctor and getting checked out in the first place. Okay. Mm-hmm. So, and this has happened to even like friends of mine or, you know, patients. You see a little spot, and then sometimes what they do is they just observe it, or they can even biopsy it.
Yeah.
But yeah, sometimes just a spot can be an unusual growth that is related to your diet, or, you know, where you are in your hormonal cycle. That can also happen because the hormones can change, like your breast development during certain times of the menstrual period. So you're right. I'm glad you got that checked out. And
one more thing.
Yeah.
I was having real bad migraines, and my gynecologist told me to go get a colonoscopy, and I had 7 polyps. Okay. And once they removed that, I just started feeling better. After my colonoscopy, they told me to just eat live food.
Okay.
Fresh fruit market food. And so I had that food prepared to me because they were saying if you eat more live food, that you will feel better.
Yeah. Very good. And I just want to make a comment. Polyps are normal. They're very common. They're normal. The concern is that polyps, if sometimes polyps can transform and or become cancerous. So it's not unusual to have polyps. The thing we're looking for in colon cancer screening is number of polyps, where they are, and then also if there's other unusual growth in the intestine that is at risk for becoming cancer. So they're going to make some recommendations for how often you should get cancer screening. And then I definitely agree with that diet. And, you know, overall, those things are good. Fresh fruits and vegetables works.
And I get colonics too. I will go to a nurse and she'll clean my whole system out. And when she does that, my headaches are less.
That's good. I'm glad to hear that.
Because my neurologist put me on Percocet, and I just couldn't take them. I couldn't take them.
Your headache must have been really bad to be on
Percocet. And so I started just to try to just manage the headaches. And the lady told me, look, go get colonics. And the nurse said, well, I needed 2 of them. My husband did it too. And my husband was 316 pounds. He went down to 241 getting his colonics, just getting his system clean out. And it was worth it because his blood pressure pill, it went down in dosage from cleaning his.
Oh my God. Marcella, so I'm so glad you said that, because here's the thing people don't even realize. Also, weight. Do you know I've seen people completely get off their diabetes medications from just weight alone, diet and weight? Or, and that's the other thing. People think, oh, I'm already on medications. Like, what's the point? You know, I don't need to change my life.
Your diet can make a difference.
Yes. So even if things seem bad, there is hope. Do not give up. Do not give up. Because I've seen people lower their blood pressure medications or completely get off of it, or diabetes medications. So it's that weight. I'm almost confident. I don't know your situation, but sometimes that weight alone and changing your diet, hey, it can just
getting out and just walking, just
and
getting out and walking.
And the only water I drink is alkaline water. I had a machine put on my faucet, and I get the alkaline water, and that helps.
Okay, good, very good.
Well, thank you so much, Sister Marcella. I love
you, Princess. And Dr. Ivie, you are sexy, honey. I see
Look,
you
she put that
graduate
jacket on. I was like, I was with the sexy. She had her shoulders out, but she
Yes.
didn't want to show her shoulders.
Y'all have a great night.
Oh,
All
thank
right.
you. Love you,
Bye, Marcella.
Bye.
Oh.
So this is something piggybacking off. She said, after hysterectomy, you go straight into menopause. My hot flashes are personal summer. I have not experienced that. So I think also is that having to do with, I still have my ovaries. So does that have something to do with that as well?
Yeah, it's possible because the hormones are regulated by a lot of things and then affect a lot of things. So actually part of your hormones are supported in the brain as well, and also your pituitary, different parts of your brain. And then yes, estrogen has effects on the ovaries and the uterus. So if you have different parts or organs in your body, you're going to feel, you may feel different. Plus, I don't know what medications she may be on versus, another person with a hysterectomy. So everybody is different. And the question is, why was the hysterectomy even needed in the first place? There are other systemic illnesses that could impact, menopause as well. So yeah, very good point.
Thank you, Ann Grace, for the super chat. This is very informative. Thanks for having this necessary conversation. Thank you so much. Does soy help with hot flashes?
I don't know. I've never heard of that. I've used other medications that have been studied. I'm not familiar with soy, sorry. But, discuss with your doctor or your gynecologist. But if you were my patient, I would just look in the literature and see if there's data about that.
Okay, and what prenatal vitamin would you recommend?
I don't have a specific recommendation, just anyone that has the folic acid. And for it to be a prenatal vitamin, it does. So for me, I've taken a prenatal vitamin. I need to be more regular, but I just like take the cheapest, whatever is like in front of me that I can find. But yeah, very good question. Yeah. But just take one. Just take one and take it every day, please.
So why do women go through so much?
No!
Simone.
Yeah.
Hello.
Welcome.
Hello.
Hi.
Hello. Thank you so much for doing this forum. Princess, you look absolutely beautiful. Dr. Ivie, whenever I see you, it's always a wealth of information. I just love seeing your smiling face. I have a couple of comments. I heard someone mention about soy, and I have heard that soy helps with hot flashes. I heard that they began studying it because they found that women in Asian countries where they consume more soy have less issues with hot flashes, and they think that soy is part of it. I also read that there was a component in Paxil, the antidepressant drug, that helps with hot flashes. So that might be something that people want to talk about. Yeah. I just wanted to pop in and say, I remember back in the 90s, you used to see PSAs all the time, public service announcements about women's health. Do breast exams, get your cervical exams, and you just don't see those anymore. So I'm so happy that you're having this conversation, because women's health is very important, and breast and cervical cancer have risen dramatically in the last 40 years, and we're talking less about it. And I don't know why. Maybe it's because I'm a kid of the 90s, and I remember that there was a fight for Roe versus Wade, and I think that possibly, created greater conversations around women's health. But I wanted to say thank you for having this conversation. And then I just wanted to reach out to Wonder Woman Marshall. She posted in the chat that she lost her husband, her job, and her home. And her doctor told her she wasn't depressed because she kept going. And I just want to say her doctor is wrong. Not only, do people continue to go and do what they have to do and care for their children when they have depression? But what she could be dealing with is post-traumatic stress, because you lose that much in such a short period of time. And, there's not a conversation or a doctor or a therapist you're working with, that doesn't just go away. So I want Wonder Woman Marshall to know that she's in my prayers, and I hope that maybe she can talk to somebody about post-traumatic stress. It's something she might want to consider. And to everyone out there, there's a book called Sisters of the Yam by Bell Hooks. I don't know if you all know. Yes, Bell Hooks. Yes, if you all want to, check that book out, it speaks to our plight as Black women and all that we deal with and how it's not recognized and how we have to keep going. So again, thank you, you two beautiful women, for having this forum. And to Wonder Woman Marshall, I'm praying for you.
Thank you so much, Simone.
Yeah, that's all.
You always come through with some facts or statistics, which is always great. Mm-hmm. So I appreciate you calling in.
Absolutely. Catch you guys later. Bye-bye.
Bye-bye.
I loved what she just said. In particular, I recommend therapy. I think everyone needs a therapist, a gynecologist, and a therapist, and a doctor, like primary care doctor. And it's not necessarily because someone's crazy or psychotic or there's schizophrenia or you're hearing voices or you want to kill yourself. It doesn't have to be this big dramatic thing. Although, if that does take place, yes, life happens. And having a therapist is just helping. It's almost like one of my friends said this, and I thought this was brilliant. It's just like having another appointment with yourself, to just focus on yourself and your own issues. And it doesn't have to be, you're crazy. It just can help you cope and process. So that's something in the Black community too. Sometimes there's a little stigma about like mental health and all that stuff, but it doesn't have to be. And it's no one else's business. You don't have to tell anybody.
Oh, yeah. I have problems finding therapists and dealing with insurance because that can get kind of expensive.
Yeah.
Sometimes I have one, sometimes I don't. Do you have any recommendations of like ways to get therapists, in our communities?
I'm actually working on that right now, and for my platform too. So in general, I talk to my doctor. Talk to your doctor. If you have one, talk to your doctor and say, hey, I want a therapist. Can you give me a referral? Sometimes, depending on your health insurance, they can cover it. But there might need to be, your primary care doctor may need to put something on your paperwork, like, depressed food. Yeah. And don't worry about that. But I'm just saying, sometimes you need a referral from a doctor. Other times, what you can do is see, sometimes in employment, they offer complimentary like services, like employment-based services that you can get maybe 8 to 10 sessions complimentary. That's one way. I know Teladoc is having, there are other telehealth-based platforms, and those, it can get expensive, but again, you are worth it. I've seen like $99 per session. If that session is an hour, that's $100. Maybe once every 2 weeks. Maybe that's something you can try and set aside instead of going out for that dinner. Maybe using that money. So also just trying to reprioritize. But you're right. I think we need to do a better job of improving access to mental health services. And I think with the pandemic, there's been an explosion of like digital-based and telehealth services. But yeah, I honestly would just talk to my doctor and look it up online, like telehealth services, and then try and, if I can, pay out of pocket. But I think it's important to get a licensed professional.
Yes.
A licensed.
There's the difference between a therapist and a life coach.
Thank you. And I'm not saying life coaches are bad, but if you're looking for something in particular, I recommend a professional, like an LMFT, like a licensed marriage and family therapist, or LCSW is their title, like a licensed clinical social worker who's actually trained to deal with anxiety, depression, PTSD, or post-traumatic stress disorders. And they have their own specialties. A life coach is good, but they're not trained in mental health services.
Yeah, they just help you with your day-to-day goals and focusing like that.
Yeah.
Candace Lane says, what types of herbs are just for hot flashes?
You know, that's a good question. I don't know. I don't know. That's a good question. I would have to, you know, do my research on that. I'm not really a huge fan of some of these herbs and supplements. I'm just going to be honest, because a lot of these are not regulated and studied. So sometimes we take pills or herbs or supplements for one reason and then have unintended consequences because they're not well studied and therefore cannot be like prescribed. Do you know what I mean? So I don't have a lot of knowledge about a lot of these herbs and supplements, but you know, I would have to just do my research. I think the issue is that people want something more natural because it's like, wait, what am I putting in my body? In general, just a good diet solves, like, literally can help about half of major issues. I swear. I really feel like good diet and exercise will help. So I'm sorry, I don't know the answer to that question, but yeah.
What's the best colonics for belly fat?
I don't know. I don't do that. Again, belly fat? You know how to get rid of belly fat? Carbs, cutting those carbs. And by the way, women, okay, I'll just stand. Women on the bottom here, okay, men and women are set up differently. And how we hold our fat is different. So we have that belly fat, it can be, you know, a little bit is like, that's womanly, a little bit, just a little bit, right? Because estrogen, that tells you, like, the estrogen in the body helps to regulate the distribution of body fat. And that's why men and women, you know, when we get larger, we hold fat in different areas and different places. And that's just what it is. So that's number one. Don't, you know, never be ashamed of your body. But if you want to enhance the body and reduce belly fat, reducing carbohydrates, trying to get rid of the rice, bread. Oh, that's the one. The breads. Trying to get rid of sodas. Here's a big one: alcohol. We have so many liquid calories. Liquid calories have very little nutritional content. And what I'm talking about are sodas. When we drink coffees, we sometimes add like a lot of creamer and sugars and it's just honey. Oh, these things just have no nutritional content. I'm not saying completely get rid of carbs. I'm just saying some carbs actually have good nutritional content, like fruits. You know, if you're going to have a fruit with carbs, at least you have other vitamins in there. Getting rid of that alcohol, okay, maybe 2 drinks maximum, or just stop with like the excess partying and then sodas. That's my biggest recommendation. Honestly, yeah. And then if you exercise over time, even walking twice a week for 20 minutes, you will be shocked. You will be shocked. Get your headphones in. I'm telling you, for myself during the pandemic, right? Like my husband bought me these headphones, their AirPods Pro. I'm not sponsored by them. I don't. He bought me these AirPod Pros, and then all of a sudden I could jog. I was the girl that was like doing like just short distances. Like I would jog a mile and just get tired. It went from like a mile to 6, 7 miles because I had music. I could like listen to, you know, playlists and listen to podcasts and, you know.
Yeah, I'm getting back to being active after not being active for a while. I never let go of my gym membership, so I'll be back there soon. But now I made it a point, like today, when I come from school, so I don't take an Uber. I'm saving money. I take the Metro train, but it's a mile walk from my school to the Metro train. Wow. Ride the Metro train and then walk home another mile. So it gives me an excuse to get that exercise in and kind of work my body back to where it needs to be.
I got you. And you're looking great.
Hi, Shay.
Hi, everyone.
Oh, I love your hair.
Thank you. Thank you. My son cut it for me and I colored it myself.
Oh, I love it.
17-year-old son.
Oh, wow. Okay.
Yeah. I have experienced all kinds of health issues. You name it, I've had it, honey. And from the far left, like stuff that you like, the doctor's like, oh no, it's a slim chance of that. And it's just been horrific. But experiencing with doctors just not believing you and not listening to you is the worst. I've had experience where I went to the emergency room and I was in so much pain, and I mean I was literally just in pain, and they gave me a psychotropic medicine called Haldol, and they were like, you can't be in this much pain, blah 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 blah. And then once they got all the paperwork back, they ran all the tests, and they came in and were like, oh, give her some morphine. She's having real bad pancreatitis. Their levels are 4 to 5 times the levels. Oh, we're so sorry. But for hours you've had me suffering with, telling me basically that I'm losing my mind. It's all in my head. And that was, crazy to go through that. Come in the ambulance in your gown. Who goes to the hospital ambulance in their gown if they're not in dire need? Like I ended up staying in the hospital over a week after that to get over that. It was horrific. And then before that, I was going to my pain management doctor, and I told him, I said, something is different with my back. I'm like, I've had back problems for years, but something is definitely different. And he was like, well, you just probably just need to lose some weight. You've gained some weight. And I'm like, no, I know I've gained a little bit of weight, but no, this is something definitely different. And he was like, no, you just need to lose weight. And I had to literally beg him. I was like, well, can you just humor me and give me another MRI so I can just at least, for my mind's sake? And he was like, well, okay, I'll give you MRI. He really didn't want to do it. He did it, and then literally the next day, when I got the MRI, they told me, they said, well, it was late that afternoon. They said, well, call your doctor. If you don't hear from him by noon tomorrow, call him. I knew that meant something was wrong because I've had several MRIs, and they don't tell you to call your doctor, the next day. So I called them. I called the office the next day, and they were like, well, when did you have it done? I said, yesterday. They was like, well, you won't get the results back, and blowing me off more and more. And I have a very ethnic name, so they automatically know just by my name. I don't care how I code switch or whatever, it's gonna be, like, hey, we know who this is, So it's really horrible. And then, long story short, the doctor called me back a few hours later. Oh, I'm so sorry. You're gonna have to have emergency surgery on your back. Do you have a preference on a surgeon? I'm like, no, I don't have a preference.
Like, what's going on? Yeah.
And I ended up having to have surgery. Had to not because I was having problems walking. I had to go into a rehab after that to learn how to walk all over again. Had to stay there for a month, and it was just been horrific. And now I have to have another back surgery that I've been putting off for since the pandemic started. So it's horrible. This one's gonna be really a doozy.
I'm so sorry. I am so sorry.
And it's just crazy how you're treated with healthcare and them not believing you. It's hard when you're going and you're seeing a doctor and you've been seeing the same doctor for years, and then for them to just tell you, oh, no. And I'm like, no, something has definitely changed.
And like you said, your body, and you're trying to communicate like, hey, I need help. So I'm sorry.
And he was like, well, we're so surprised. How could you come in here? Have you ever heard of Claude-Equina syndrome?
Yes.
Yes, I experienced Claude-Equina syndrome.
Wow.
Yes. And he was like, well, how were you able to walk? And you weren't crying. You weren't screaming. You weren't. I'm like, I was bearing it. Like, and most people, and I suffered, severe nerve damage because of that with Claude-Equina. You're supposed to have emergency surgery within 24 hours.
Okay. So I guess I'm wondering, are you walking now, or are you?
Yes,
You are? Okay, so you regained something. Oh, that's, sometimes people, you're right. People can present differently than the textbook. And like you just said, everybody is different. So at least you advocate. Imagine if you did not advocate for yourself, if you didn't feel comfortable, pushing and saying, no, actually, I really do think something's wrong, or taking that extra mile or that extra step. And a lot of people don't really feel empowered, or feel like they're not going to listen to me anyway, or it's probably nothing, or something.
I was having intermittent time where I was unable to walk. Like I was, sometimes I would.
That's serious.
It went on for over a month. So
I'm so sorry.
I would not be able to walk, not able to feel myself from my waist down. And I didn't even know that from after I had surgery, that he didn't expect for me to walk again. When I was in the rehab, because I told him, I said, well, I can go home. I have help at home. I have family members that'll take care of me. He said, well, no, it doesn't matter. Even if you have 24-hour care, you can't go home. He never told me why, which I'm actually glad he didn't, because it probably would have discouraged me. And I ended up, once this was the surgeon that didn't tell me. I'm not my pain management. He's an idiot. But once I was went into the facility, the rehab facility, like I was there after about a week. I had, you press the button when you need to use the restroom, you need to get out of the bed. And I pressed the button, and the lady came in, and she had been off for some days. And I said, I need, you to get my walker to help me get to the restroom. And she said, you mean your wheelchair? And I was like, I only use my wheelchair when I'm going to another floor for other therapies. I said, I use my walker here in my room. And she was like, you can walk? I was like, a little bit. What do you mean? She was like, this floor is for people who are never going to walk again. This is why they put people on this floor. And I cried. Oh my God. And then for you to even ask me then is ringing tears. I know most people don't overcome cauda equina. It's horrible, because for people who don't know, it's where your spinal cord is being pinched off. And they had to go in and burst space in my spinal canal for my spinal canal to actually be able to thrive. And so once it pinches it off, your nerves they start dying. And so you lose nerve reception and feelings and stuff.
Testimony.
Like there's certain parts of my legs you can touch, and I would never know that you're touching it unless I look at you.
I'm so sorry.
Yeah. It's crazy, and it comes and goes to different parts. And I already have fibromyalgia and other pain stuff on top of all of this. Like I put in the chat, if I were to put all of my diagnoses in there, people would be like, what? You just have a whole medical dictionary behind you.
It shows you're an overcomer. And you sit up here and tell me you don't have nothing to talk about. You have a lot to talk about and a lot of ways to reach people. It's all about, this platform is all about sharing who you are, and then just sharing what you're comfortable with talking about. But you have plenty to share. You just shared a whole lot just then.
Yeah, I guess so.
Well, thank you for calling in, Shay.
Thank you for having me. See you guys later.
All right.
Bye.
Bye. Thank you, and Grace, for another super chat. Princess, do you have plans on bringing in a therapist and doing a session on mental health? Yes, this has crossed my mind. Yes, I have been putting the feelers out there. One thing I was going to definitely talk about is mommy mental health, and why we happen to think just because we have kids that they are the only thing that matters, and you don't matter. I'll tell you, F them kids in a minute. I had to learn that you come first. If mama's not happy, nobody is happy. You have to take care of yourself in order to take care of your household. So also, I want to make sure that when we talk about mental health, that we have the right kind of people, because we have stuff like this, the life coaches that don't have credentials, and they be telling you their opinions versus things that are fact and that are studied. because Derek Jackson is a life coach. Okay, this is one of those people. And I don't want to be a part of this. Dr. Ivie. Disseminating all of this type of information, and I don't necessarily know everybody, but I do want to have some reputable people like Dr. Ivie that that is giving information that will help you and will help you right, and not just be sending you over there to the left. You know what I'm saying? And oh, look at this, Patty. I did cut down on sodas a lot.
That's okay. That's all right.
I eat and watch 600 Pound Life. So my favorite, hey, it's Miss Weedy Pooh.
Hello, how you doing? Hi. Can you hear me?
Yes.
Oh, okay. I was the one who typed in that I did not give. I was not able to have children, but I had to have a hysterectomy at the age of 41. The problem I have is I could not have children anyway because I could get pregnant, but because I have an AVM on the left side of my brain, they would never allow me to have children. So then I went from that. I had 3 pregnancies. They took the last one. Then all of a sudden I started having, my period lasted for 3 weeks with 1 week off.
Ooh.
Yeah. And it was very, 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 very heavy. That's when I started having, I told the doctors I need to have something done. They, just like Shay, they kept saying, oh, it can't hurt that bad. It can't hurt that bad. And I'm like, you don't know my body. How you going to tell me it cannot hurt that bad? Plus, I'm having periods for 3 weeks. And next thing you know, I've had a myriad of problems health-wise. Then I had three small strokes.
Oh.
Then the last stroke I had was a large stroke after I found my brother dead. It waited for 5 hours. And then I had the big stroke. I couldn't talk for like 2-3 weeks. So I'm going through PTSD and all these different illnesses going on. So I'm trying to figure out. I have a therapist and a psychiatrist. What can I do for the pain? I mean, I still have residual pain in my, not my ovaries or anything, but my back. I have really bad back problems. And
is that from the epidural?
I've never had an epidural. I had back surgery.
Oh.
I had back surgery that only lasted 2 years. So what do you think I could do now, besides going to, without adding an extra doctor? Because I have doctors on top of doctors.
Right. I guess, I would want to know a little bit more information, but, thank you for sharing that. So are you able to talk to any of the doctors that you have? Are they aware that you're having ongoing pain?
yes and no, because the last time I told them that I'm having the back pain, they suggested I have another back surgery.
Right.
And that back surgery almost took me out. I mean, I
see.
I'm sorry.
Oh no, go ahead, ma'am. Go ahead. I was just saying I see. Mm-hmm.
I asked them to just go ahead. That they after the surgery, I asked them to go ahead and just give me an overdose of morphine because the pain was so bad. So I had decided that I would not elect to have another back surgery.
Okay.
But I go through different pains. Yeah. If I don't have one pain, I have another.
Okay, so here's you have a lot of challenges, and I'm so sorry that you seem to be under a lot of pain. You're in a lot of pain, and you're under a lot of stress. Clearly, I can't provide medical advice, but just information and guidance. So if someone comes to me who's had a recent back surgery and is having ongoing pain, I honestly would want to talk to them a little bit more, examine them, and figure out what's going on. It may or may not, I'm saying in general, not you specifically, in general, it may or may not be related to the surgery, depending on when it took place. But also whatever caused the back problem in the first place could be having a flare-up. Because that's the thing. I was wondering when you were telling your story, oh my gosh, should she consider having another surgery? But you said no, that's out of the question for you. But I would want to know, okay, want to know more. Why don't you want to have another surgery? Are you having certain concerns about complications? And then, the surgeon can talk to you more and more about that. But then the other part of this is, in general, I'd be wondering, was there an accident, fall, or trauma that took place? Do you have, significant changes in weight? Yes or no? I would be really all up in your business. So I need to know more. Do you have people were asking about clots or new issues that have come up? Do you need new imaging so we can try and identify the issue? Then the other half of this is, do you need a change in your pain medication as well? And then I would want to know your occupation. Are you lifting heavy things? I need to know more, but I think in general, it's good just to try and talk to I know it's annoying, but talking to your doctor and having a dedicated time to reevaluate what's going on. You deserve that. I really would recommend that. Yeah.
Okay, because I'm seeing my neurosurgeon on the 19th. So I'm wondering if I should ask them, because I have really bad scoliosis. My spine goes one way, and then it also goes another way. If I'm to the side, it looks like a C, a sway back. But then they say also with the imaging, they saw my spine is curved like an S. So it's like, but I
you went from a C to an S.
Huh?
You probably went from a C to an S.
No, I got both.
Oh, okay.
Yeah, the S, the C has an S in it.
Okay. Because your anatomy may be unique. Have you also considered therapy, like physical therapy, in a way that's safe for you? The only thing is sometimes physical therapist may want clearance or you to be seen by a surgeon, depending on the situation?
Because when I had the last stroke, I had to go through all the therapies. I had to go through physical, occupational, and speech. So that I could so that I would be able to walk correctly and everything. But I think I'm gonna have to take your advice and see another sign up for more therapy.
Yeah, consider that, absolutely. And if it just becomes out of hand, heck, if you have to go to the emergency room, do what you have to do because you're worth it.
Thank you.
See how I'm saying that? You're worth it. Everyone listening to this live, you are worth it.
Thank you, because
you're welcome.
Princess. Because I don't like to go to emergencies because they always make it so minimal. That's how I ended up having a hysterectomy in the first place. They made it sound so minimal that they kept saying, "Oh, it can't hurt that bad. It can't hurt that bad." They did an examination, and the doctor found out how bad it hurt because I almost kicked him in the face. He does it just in time. It's not funny. I did say excuse me, but he examined me and it hurt and my leg went out and he dug. He said, "Okay, we gotta sign you up," because it was so painful. So, like I said, I've had a myriad of surgeries, pain, all kind of things going on, and I just wanted to ask also what type of doggone it, medications or herbs or whatever that I could take for the hot flashes. The hot flashes are killing me.
Yeah.
I've heard a lot about black hole hash.
Okay.
Black hole hash. I hope it. I'm gonna try it because I sleep in the under the fan in the wintertime with the windows open.
Ooh.
And my significant other, Mr. Man, he's not happy at all because it be freezing in my house is freezing right now. I could put a meat out on the counter and it won't go bad. It's so cold.
Oh my goodness.
That's because it's just bad. But thanks for your advice. I wish I could talk. I'm so sorry about that.
No, just breathe and take your time. You okay?
I'm gonna go try to get on YouTube. I don't care about the stuttering.
I told you we love you, Miss Sweetie Pooh. You all right?
All right. Thank you.
We don't care either.
Okay now. Okay, thank you so much. Thank you so much.
Thank you, Miss Sweetie Pooh.
All right.
Thank you for calling. Christine Lambert says, has Dr. Ivie or anyone heard of Coach Gessie, Dr. Amun, or Dr. Amsu about detox and getting rid of fibroids without surgery?
I've actually heard of some of those people, but not specifically on that topic. But yeah, in general, with these questions about details about fibroids and endometriosis and things like that, please talk to an expert gynecologist who's specifically trained in this area.
And I'll see if I can get a gynecologist or my gynecologist in here. My gynecologist, I've had him for going on next week 18 years.
Oh, wow.
He delivered my daughter, and so I've had him in my life for 18 years. And he's going into slow retirement because he's old, and he's turning the practice over to his daughter. And his daughter is the one that performed my hysterectomy. So they have the same practice. So now I have two people that, you know, are intricate and that could look at my case. And, you know, he has the experience with me first, and now he can inform her on things that are going on. But her being younger, and she's more privy to new technology and new ideas. And they said they argued over me when I got ready to have the surgery. We're going to do this. No, we're going to do that. And so essentially he just came in and he played with me. He's like, okay, I just came to see how you are. I'm going to go get some coffee and I'll see you later. And she comes in. She was like, well, my dad is supposed to come in. I was like, he came and left and said he was going to get some coffee. And she was like, really? So it's good to find someone, no matter what type of doctor you have. Even my primary care doctor is a father and son, and now the son has a wife, and they're all in the same office.
Yeah.
If you don't like somebody, go somewhere else. Okay. If you can't, you know, it's just like dating. Sometimes you gotta try.
Thank you.
Try a few people until you find out that one that you really like and that you know, get in good with. But I have different doctors for different things.
Yes.
Different specialties. And that's important too. I think we put sometimes all of our weight on our primary care doctor, and we shouldn't, because that's just what they are. Primary care doctor, go get your checkup or whatever. But when it comes to my coochie, I'm over there for women only. Okay. When it's on my stomach, I'm over there with Dr. Claudette. You know, I'm working on getting a chiropractor because I have scoliosis. So it's important. It's important to have different doctors, different things. When I had that stuff, I didn't know Black people got hives. Okay.
Yes, we do.
Until it was on my body. I did not know at first. It was itching, and I thought a mosquito was biting. I was like, but ain't no mosquitoes in here. I'm like, what happened? And literally, I'm sitting here in my house, in my bed. Thank God the young man was here. My throat started closing up on me, and I had a couple of hives come on. And what really alarmed me is my lips started swelling. I got big lips, and when my lips get bigger, it's a problem. Okay. And he was like, boo-boo, something ain't right with you.
Right.
Let's go. Right. And I was like, well, and I still lollygag. Well, let me get myself together. I'll be all right. Water was not fixing the cough. I had no idea that my whole throat was closing up right then and there. And then the breakout started breaking out. And so when I got to that doctor and I walked in and it was like, you what? And they looking at me. I'm like, well, let me show it. EpiPen immediately.
You need that. Yeah.
And now I carry an EpiPen with me everywhere I go because I don't know, especially when I'm outdoors in grass and stuff. It's important. And I want to say sometimes even money, this is important when you go to other channels and other people, making sure if you can that you have some type of money to get yourself into a financially stable place. I put off the surgery for months, okay? When I made the decision, it was either have a myomectomy or have a hysterectomy. When we finally got to that place, because they kept saying, oh, you're young. We don't really want to give you a hysterectomy. You think you want to ask me? I'm like, hell no. I don't want to have no kids. I already had some, you know. And I got one grown one almost grown one. I was like, I'm not trying to hear the pity patter of little feet at this point, because the young man wasn't the prime young man, and I was like, okay, let's let's be done with that part. I'd rather be living than worrying about having some kids, because if I'm dead, I can't have none no way. Okay, and then the ones I got aren't gonna have a mother. So, but one thing that when he came into my life, he said, well, it's important that you speak to your son, especially, and your kids, about having the hysterectomy versus the myomectomy. That they should know what you're going through and have empathy for you and see what they think about it. And I, was on the fence, and my son made it clear. He said, well, you already got 2 bad kids anyway. What do you want some more for? He said, we can go pick one up at the store if you want another one. And he said that I would rather you have the hysterectomy versus the myomectomy because of the chances of you redeveloping fibroids. I don't want you to have to continue to go through surgeries like that, and we have to possibly lose you. And my daughter was like, well, can you freeze your eggs and stuff? I'm like, we're not rich, okay? But I will still have my eggs just in case I decide to have some children. Do you have any experience on that part, Dr. Ivie?
Oh, yeah. Yeah. So about like the egg freezing, right? And the decision to do a myomectomy versus hysterectomy. So, okay. So the first thing, these things are a very personal decision, and it's you made the decision that's right for you and
for me.
Yes, and your value set and where you see your life going. I'm just glad that they told you about the option of not removing your whole uterus, but maybe like a part of the problem, because sometimes we want to be able to preserve the uterus in case you want to have children in the future. That's your lineage. That's important. And when we're talking about families, you want to always have that option, because I think women and men should know, like, what is their, family plan. So that was a personal decision, and that's right for you. You have 2 beautiful children, and that's good. So, relating to egg freezing, the good thing about egg freezing is that it captures the quality of the egg at that point in time. So I generally recommend women, especially like professional women or people who've gone through medical conditions, to consider that, because as women age, the egg quality gets lower, and so the chance of getting a pregnancy gets lower, and higher complications, even if a pregnancy does take place. So if people freeze their eggs at age 30 and don't use them until age 40, that's fine, because you've captured it at that moment. Now, of course, for people who don't have a uterus, you can't, implant a fertilized egg. There's nothing there. It would have to be, sometimes people discuss
surrogate.
Yes. So I guess that's my point, is that what I like about what you're saying is that you were plugged into the system. You had the information so that you could make the best decision for yourself. My concern is that sometimes we don't even have the information to make the decision in the first place. Okay. So that's the important thing. But yeah, that egg freezing thing, we're in modern medicine, we're in 2021, there are options. And I just want to make sure your listeners at least feel empowered to ask those questions. If you don't know, sometimes you don't think it's possible, but ask. And even cost-wise, you would be surprised. If you could buy a car, you might be able to afford egg freezing. I'm serious. Sometimes we're not conditioned to spend money on things we can't touch, that we can't see. We're paying for sometimes a service or a future benefit. And sometimes we're not conditioned to do that. So just open, I want your listeners to just, be aware of that and open your mind to different possibilities. So if you can buy a car, you might be able to afford this, or save, talk to your doctor. And seriously, these things that you hear on TV, we have access. We can create the access to these things. We just have to make the phone call. Sometimes it's literally a phone call or an appointment or asking that question.
Wow. And you just informed me it's cheaper than I thought.
It can be. It can be.
Yeah. And I made the decision to have the hysterectomy in November. I said I would wait till March after taxes came back because I knew I would have to be down off of work for a couple of months. And I was worried about who's going to pay my bills. And there was nobody there for that. But a few friends reached out. They were like, well, we'll help you. Even my son was like, Mom, I'll send you money if I have to, to make sure that you're all right. But then the pandemic hit and all of the surgeries were frozen.
Right. Elective surgery. Yeah.
And then I was at the top of the list. I started getting so bad that as soon as it opened, she put me in the first 5 people that were going to have surgery. And I was at the top of the list. But then again, the kicker to that was I go into surgery and nobody can be there when I wake up. And so it was only down to a few text messages, and the next day the people could come, but at the hospital I was at, but it was within a 2-hour window, which was really weird during the week. And it was a Tuesday and people are working. So it was like, really, those are times you want to have somebody there. So even the mental part of it was a lot to take in. I still have triggers about it every now and then. Because I'm sure people are still going through this thing, because the pandemic is still around, and hospitals have restrictions. I heard my sister in Alabama, she went through breast cancer during the pandemic, being diagnosed to going to chemotherapy and having to drive herself to chemotherapy and back and still deal with her children through the same thing. So this is not no joke. It's not no joke dealing with this. So it's still a mental thing we all have to deal with. We got to get healed mentally from these situations. Did I ever have an allergy test for hives? Yes, I had to go to a specialist. Good. My main source of allergy is called Alternata alternata. And it's funny, the funniest and most simplest way that I can I can say it is my friend who works in healthcare. She says, "Girl, you allergic to outside?" That's pretty much it. It's spoiled plant spores, rotten plant spores are a trigger for me. Mosquito bites are the worst. You don't see me out in nature walking reading to the children, walking in nature. That's not quite my thing to do. I'm not fully afraid to go outside, but I feel like I have to be fully protected because I'm very triggered. I use hyper mosquito lotions and sprays. I'll have the beeper on, all of this stuff because I got some sweet meat. And, I know certain plants I can kind of see like poison ivy or something like that. I'm not in the grass or none of that when I'm outside. I just try to steer away from it just to make sure, because I'm not sure what is what, in order to kind of keep from going to the hospital using that EpiPen.
Your story, you just have a wealth of information, Princess. And what your story also demonstrates is the importance of relationships. The fact that unfortunately you couldn't have a lot of people in you didn't have anyone really in your hospital, in the hospital room to support you. But having good relationships makes the treatment plan better. Like, for example, you talked about your significant other kind of encouraging you to go to the hospital when you had, the breathing problems and your lips were swelling. We can't see ourselves, like you can't see your nose. Sometimes we have our own blind spots. You know what I mean?
Yeah, and I'm that person like, oh, I'll get through it. Like, I'm not going to the doctor until it's really bad. I'm that person. Oh, I gotta take care of the kids, or I gotta work, or I gotta do something. And I would have sit there and partially died, watching TV because my throat would have closed up, and I'm just coughing. I'm trying to drink water, thinking, oh, something happened. Maybe I choked a little bit.
Yeah,
no, I wasn't choking. My throat was closing up.
So I see exactly, and that's what I'm saying is, it's important. And that's why sometimes couples, it's just so important, or friendships, or having a neighbor, don't live alone, or don't live. What I mean is like socially alone. Don't do that. And the other thing is, I want us also to be good stewards for other people as well. So, like, for example, in your situation, I would say, okay, you and your partner, both people need to know where the EpiPen is. And actually, I would recommend having at least 2 EpiPens and making sure
one in the house and one in my purse.
Yeah, exactly. And there, for example, asthmatics. This is something I encourage my patients and like people who come and see me. I do, counseling about this. It's not just about giving you a medication. It's about getting you and your support team on the same plan so that you're safe and you're healthy and you can live your best life. For my asthmatics, this is a little, trade secret I encourage my asthmatic patients. There needs to be an inhaler everywhere you are. And I literally will recommend like at least 3 inhalers, 1 at the office or wherever you work, always, 1 in the car, and 1 in your home, at least, maybe at least 2 in the home. And then your spouse may need to have another emergency one as well, just in case,
It's important because I've had a friend from grammar school. She died. Oh my God. Time flies by so quick. It's been at least 5 years. She was in her early 30s and it was basically an asthma attack. And her husband was there when she died. Like they were sleeping or something, but she went to the hospital earlier. Again, that undiagnosed, and oh, you'll be okay. Sent her back, and she died. So these things are important. Even with the hives, the way I got my allergist is the young man. I went to the hospital, got that EpiPen, got that treatment. They sent me back home that same day. I was miserable that day. He stayed from work to care for me. And then he was going to work the next day and he got me up out the bed. He said, honey, you're going with me. And he works like an hour away. He said, no, you're going to these light-skinned people's hospital. Okay. and he dropped me off on the curb because that's what you had to do then. Dropped me off on the curb and I went in and they helped me for 5 days.
Yeah, you need the support. We all need support. Period.
So it's important. I don't care who it is, even if it's your kids. Yeah. Somebody that can care for you.
Yeah. Yeah.
The question is, why do they dismiss us like that? Excuse me.
I'm sorry. Do you know how many? It breaks my heart every time I hear these things, and I'm not going to pretend like I've had, the most perfect as a patient. Sometimes, there are times where I'm like, oh, I'm disappointed in what's going on. But I think finding the right person or the right doctor, and it's also a team, because if the office is not as supportive or responsive, then, you're at risk too. I'm sorry. I really am sorry. But the truth is, I truly do feel that most people are well-intentioned doctors and nurses and providers, but I don't ever want any of you, Princess, or any of your viewers to be lost in the system or feel intimidated or feel like, hopeless. You are worth it. And I think it's worth trying to find the right person that speaks the way you speak. Like you said, the dating analogy is perfect, you know? Yeah, I'm sorry. It's hard. I really try and check myself and make sure like my tone, and I explain things, and, you know, I try and answer questions that weren't even asked. Just give people the information so they can do what they want and make the best decision. You know, it's not easy. No one should feel dismissed. That's not right. I hate that. I hate that. But, you know, healthcare, you know, there's so many patients and not enough time, and, you know, everyone's underpaid and overworked and all this stuff. So sometimes it's not that one person, it's like the whole system, and trying to find a system that works for you. I know it's not easy. I'm sorry.
But we have hope. And it's always one. There is somebody for you.
Yes.
Dr. Ivie, do you have any closing remarks or anything?
You know, I just wanted to say thank you for having me. And, you know, my goal is, you know, I'm trying to follow in your footsteps, Princess, and definitely, you know, grow my channel. Yeah, I'm serious. I'm serious. You know, of course, what I do is medicine, but I also have a passion for people and healing. And I think there's ways to do it that's not just in the hospital or in the patient room. I think there's healing that can be done on the internet. So, you know, with the pandemic, I just felt like, oh my gosh, there's so much misinformation about COVID and everything. And we need someone to step up, like someone should do something. And I kept thinking like, oh, and then I realized, oh my gosh, it might as well be me. So I'm trying to grow my platform. So, you know, please guys, definitely follow me on my Instagram. That's right here listed at DRIVIEOA. Certainly follow me on my YouTube channel, Ivie Okundaye Appiah MD. And basically I'm encouraging everyone to just be their own health advocates, health and wellness. And I also offer personalized health information, and create personalized health plans for people. So people have found that to be helpful. If you want to talk one-on-one, we can. I'm available, you know, for anybody. But yeah, you know, I also encourage, you know, people to get into healthcare and medicine if you're interested in being a doctor. I also mentor students and, you know, do mock interviews and stuff like that. It's a mindset. So you know what, definitely, please, I would love your support, and any topic suggestions and ideas, let me know. Thank you so much.
Okay, you have someone can ask her, can she be my doctor, please?
Oh, sure, Miss Richardson. But yeah, like I said, I'm working on my own platform where I can see people, like, you know, telehealth wise. So yeah, just follow me on my social media and keep in touch, okay?
Okay, and I just posted her channel, but I am going to post her channel and all of her information in the description box and in the chat. Dr. Ivie, we got to shorten up your name. We got to change it so just Dr. Ivie. I had to learn how to do that. Makes it so much easier. Where is Dr. Ivie located?
You know, I'm all over, but primarily based in New Jersey now. And then again, also on the internet, on YouTube and Instagram. But seeing patients, I'm working on trying to see patients, you know, telehealth wise. So just like I said, you know, stay in touch with me and I'll get you in touch and we can take care of you.
All right. Thank you so much for coming, Dr. Ivie. This is a great night. I'm excited. See, I don't have to be ratchet all the time.
Oh, thanks. Thank you.
But thank you for coming. You are at home now. You're a part of the Royal Citizens and special guest, so you could come back anytime.
Thank you. Thank you. And Princess, you have to come back on my platform too.
Absolutely. No problem. I'll get up out the bed for you.
And you have, yeah. Thank you. And thank you to the Royal Citizens and the House of the Princess. You are amazing.
All right. I'm going to put you backstage because I got to get your information. So leave me yet. But I'm going to put you backstage so I can do the business with the royal citizens.
Okay.
All right. Thank you. Bye-bye. Okay, you guys, I do thank y'all for coming. I thank you for the support, and I thank you for the super chats and the donations. So we got a lot of stuff going on. First, I have an announcement. If you ain't been on Instagram or been on the community tab, just to let you know that tomorrow, where is it? It's not coming on top. Well, see, this when the show gets ghetto. Okay. Well, the other stuff comes up. Well, why this ain't coming? There we go. The Crown Jewels panel starts tomorrow. So we are doing the recap of the Real Housewives of Potomac. Now, you know, I still got to have my little celebrity tea in there somewhere and our little diversity. Now, everybody that has shows today, they're good, but my show is going to be great. It's going to be the best. And of course, my sis, Sanitra, is the co-host, but we're also introducing some new royal citizens. And that's Shady B of the Shadier Room. Y'all might know him, but you don't know him. And if you don't know him, get to know him. And the lovely, lovely Miss Mace Moreau. And you can follow her on Instagram, follow Sanitra on Instagram, follow everybody on Instagram. We will be back in the house tomorrow at 6:30 Central Standard Time. We'll be here every Tuesday at 6:30. Thank you. At 6:30 to talk that talk and to have a good kiki. Thank you, Al, for the super chat. Thank you so very much. Yes, I'm here for it. I want y'all to be here for it. It's gonna be live. We're gonna have jokes. You know, you bring your cool beverage, whatever it is, water or wine, to make yourself feel fine. Also, a part of these initiatives, I need a couple of things. I know I'm trying to read these messages, but I know some of y'all are sending me dissertations. I need you to not send the dissertations because I got a lot of stuff to do. I'm having a panel for Love and Marriage Huntsville. We will start the chit chat on Sunday because it starts airing on Saturday. Those who would like to petition to be on the panel for Love and Marriage Huntsville, please email me. Let me put this email up here. You can either email me or you can put it in a DM on Instagram. You can send me a no more than 2-minute video explaining your name and your age, because age is important. No, it's not. Your name and your age, why you would like to be a part of the panel, and what do you have to bring to the panel conversation, because that's important. And I need to see how you sound on camera, how you look on camera, and how you speak is important. This is why we ask for videos. Oh shit. Oh, excuse me. It's a cat in here and he's scared. He's scared the hell out of me. And that was just so random. So yes, it's important that we can converse and see how we gel with each other. So that is why I need going somewhere. God damn it. I'm allergic. You better get your ass away from here. Look, Oscar, say hi. Okay, and say bye. Get out of here. And I'm allergic to cats, which is funny. I have a small allergy, but not a big allergy. But yes, Dr. Ivie, I have a small allergy to cats. They have to be clean. You should see Dr. Ivie. She's about to have a whole fit. You have to get out. Dr. Ivie says, get out, Oscar. Oh, wow. He just looked around like whatever. But it's just a 1. It's not a 5. It's just a 1. When it comes to the cat, I just keep my hands clean, and I don't rub my eyes. And I keep him out of, if you stop scratching up my bed, I'm beat your ass trying to close up this show. So I just try to stay away from him while he's here. Yes, I do keep the Benadryl on deck. I think he's ghetto wherever he came from. He was at my daughter's friend's house. They must have been feeding him real ghetto, because every time I rustle some paper or of a bag, or he knows that I have food, he comes running. I got to go to the allergist tomorrow. Yes, you have an allergy test. Allergy tests are important. You will find out, it's amazing what they tell you that you're allergic to. I didn't even know that I had a small allergy to dogs, depending on what kind of dog allergy it is. So you find out all kinds of things about yourself if they run a full allergy test. Dr. Ivie. So other than that, he made me lose my train of thought. I know I'm gonna run a sale too. I'm in trouble. See, y'all got it. Oscar, you got me in trouble. Come tomorrow. Also, I am looking for the panel. I'm looking for a trainer or nutritionist. If you are a trainer, physical trainer, I am going to do our weight loss journey with an actual trainer. And we already have a person I'm looking at strongly to do meditation together and yoga. So this is like a whole holistic thing. Again, we're multifaceted people. So soon as I get that done, we will have our memberships in place. I'm trying to get it done in the next week or so. You see the emails? Okay, email me, DM me, contact me if you have these credentials and you could do these things, because I'm not the only one that's out here fat. I'm not the only one that's out here may have weight loss goals or just health goals. And it's not about competing with one another. It's not about, I need to look this way. If that's what you want to do, that's fine, but just your personal goals. This is about us looking good and feeling good. Because I can tell you, when my weight comes down or when I get to walking and I get a routine, you sleep better. You feel better. When you start to look better, it brings you out of this depression. So it's a holistic thing from head to toe. So I want to include that in my memberships. That's why I haven't been quick to give you memberships, because if you're going to pay, I want to give you something that you're going to pay for, and I feel like I'm giving you back. So that's important to me. So as we do that, be patient with me. Yes, we're going to be together, okay, as a community, and we can encourage each other. And as I said on the questionnaire, when we have accountability partners and we can lean on one another, it makes us feel better and it motivates us, so we don't feel alone. Like, oh, if she can do it, I can do it too. I can drink my bottle. I have a problem drinking water. I can drink my bottle of water today. Or if I didn't get 2 miles, but let me at least get 1 mile. And sometimes the hardest part is just to start. It's not after you get in it, it's the start and getting your routine. So I want us to get a routine together. Thank you. Get us a routine together. So I think that's important. So it's some things coming. I'm in love with it. I'm excited for all of us together. We see each other. So outside of that, again, just make sure if you're new here, please subscribe. Support a Black sister. And I did throw the Black in there. Support a sister. Like the video, subscribe, because I have a lot of exciting content and diverse content to give you. Hit the notification bell, even though YouTube been kind of trifling. We're going to pray for them, okay? That you're going to get the notifications every time I come live. Follow me on Instagram. Also, I told y'all I'm about to bring in this throne room. I'm not playing with you. Email me, if you have advice questions, Okay, and I'm going to take it to the throne room. It could be anonymous or you can put your name in it. I don't care. I ain't going to tell everybody your business, but I'm just going to read the letter. And we're going to give advice to one another about your issues. So that's going to be the throne room segments. And email me if you have a concern you want to be included in the throne room. So that's okay. Oh, don't feel that way, Shay. It's going to be all right. I'll be feeling that way too, but we be self-conscious and we think, oh, I used to be this or that. Just live for today. Man, take it one day at a time, 1 pound at a time, 1 ounce at a time. Just live for today, and it's going to be okay. Thank you. Thank you so much. Yeah, I'm all about having fun, but honey, water off a duck's back. Like, I figure I have been through so much in my life that what do I need to be sitting around here uptight for? God has spared my life, and I'm here. And I'm planning to be here for a little while. I still got my little bit of a thought agenda. I got a lot of traveling to do. I got a lot of fun to have. And I want you guys to have fun too. So with that being said, I am going to turn the lights off here at the castle. I'm going to go do some orders. If you got to order, it's coming. It's going to be in the mail in the morning. I know I got to read some emails, but I saw the previews of them. So yes, orders are coming out in the morning at the post office. Anything else? I love you guys. I thank you for being a part of my family and my support system. Whether you believe it or not, you are my support system as well. And I am here for you if you need to talk to me. Again, like, subscribe. Thank you for coming to the council. It's time for me to turn the lights out. And you have watched House of the Princess, where I'm Princess AV. I'm 50% righteous, 50% ratchet, and you have a great evening. Hug your kids and stuff. Bye-bye. Royalty Beauty Brands is a female, Black-owned beauty company with all of your cosmetic needs in mind. Right now, we offer hair extensions, eyelash extensions, and our flagship product, Yumbella Lip Glam. Coming soon to add to our product line will be promo merchandise, lip oil, lip scrub, beard oil, body butter, body soap, and makeup, to name a few. Every product is vegan friendly and carefully made with the consumer in mind. Check out our Royalty Beauty Brand social media and go to our website to sign up for our exclusive mailing list for discount codes and to place an order. Don't forget to leave us some feedback. Royalty Beauty Brands. We see the beauty in you.